Hi, I'm Dr. Kritika Kapali. I'm an infectious disease physician at the Medical University of South Carolina in the College of Medicine. My background is in emerging infections, biosecurity, global health, and pandemic response. I have been assisting with the vaccine rollout as one of the medical leads and have also been involved with the COVID response here at MUSC. So I'm going to answer some questions today about the COVID vaccine to help people get a little bit more information. And if you have any questions, feel free to type them in and we'll try and get to them here today. So the first question I have here is, why did I get vaccinated? So one of the reasons I chose to get vaccinated is that I wanted to help protect myself and hopefully, as we get more information about the COVID vaccine, help prevent onward transmission of the coronavirus. I think these vaccines are really great and they help prevent us from not only getting severe COVID, but also preventing us from getting death or dying from the disease. And so I think that that's really important information, and I wanted to help keep myself healthy and strong during this coronavirus pandemic. The second question is, what kind of side effects did I experience? So I actually did pretty well with the COVID vaccine. I was really lucky and I had the opportunity to get the vaccine on the first day we offered it here at MUSC. I got my first shot in my right arm, and about 4 hours later, I started having some injection site pain, so some pain right where I got the shot. And that lasted for about a day. It got worse the second day after the shot, and it felt kind of like a tetanus shot. And then it went away about 24 hours later. I didn't take anything for the pain, and I felt fine after that. My side effects after the second vaccine were a little bit worse. I got my second vaccine in my left arm, and the pain actually was less than how I felt the first time. However, about 26 hours later, I started feeling really tired, more so than I had felt after my first shot, and I had some aches in my body. And so what I did is I went to sleep early that night and I took about 400 milligrams of ibuprofen. And by the next day, I felt fine. So I was pretty lucky. I didn't have any really serious side effects from the vaccine, and I did pretty well. And so with the Pfizer and the Moderna vaccine, the most common side effects after the first shot is going to be actually that injection site pain. And the other common side effects is having some redness at the site. Those are the two most common side effects. Side effects are most common in people under the age of 55 compared to those over the age of 55. And then with the second shot, the most common side effects are going to be what we call systemic side effects. So people are going to have fevers, they're going to have muscle aches, they're going to have fatigue, they may have headaches. All of those side effects are common within the first 3 days after the injection, and many of them are controlled with just some conservative therapy, so things like ibuprofen or Tylenol. But most people do very well with the vaccine. There have been very few adverse events reported with the vaccine, and I think that's really important to know. I know we hear these things in the media, but those events are actually very few and far between. These vaccines are very safe and very well tolerated. The next question I'm going to answer is, how does the vaccine work? A lot of people have questions about what is an mRNA vaccine and how is it different than other vaccines. And I think, one of the questions we get asked commonly, and one question that people have, and is because they hear, oh, this vaccine was developed in record time. Well, in actuality, the mRNA platform that was used to develop this vaccine is something that we've been working on for about 30 years. And it's a vaccine platform that has been used to look at vaccines for other infectious diseases like rabies and Zika virus and CMV, cytomegalovirus. So we have been studying it for other viruses. It's just gotten obviously a lot of attention for this virus, and especially now because it's the vaccine that we're using. So to explain this how this vaccine works simply, the COVID-19 mRNA vaccine gives instructions for our cells to make a harmless piece of what is called the spike protein. The spike protein is found on the surface of the virus that causes COVID-19, and the COVID-19 vaccine is given in the upper arm muscle, and once inside the cells, the mRNA is made into a piece of the spike protein. After the protein piece is made, the cell breaks down the instructions and gets rid of them. Next, the cell displays the protein piece on its surface, and then our immune system recognizes that protein doesn't belong there and develops an immune response and makes antibodies like we would do naturally if infected with COVID-19. In the end, our body learns how to protect against future infection. So now, because our body has already made antibodies against this piece of the spike protein, if we are exposed to the COVID-19 virus, then we already know how to make the antibodies. So those antibodies are able to be made quickly and protect us from the coronavirus. So that's how the mRNA vaccine works. The next question I have here is, why does vaccination help? And how many people will need to be vaccinated so we reach herd immunity? That's something we get talked about and is brought up quite a bit. So when we talk about herd immunity, the number that's thrown out there quite a bit is that about 70 to 85% will have to be immune before we can see decrease in the number of cases, or we see the disease kind of taper off. The idea of herd immunity is that after enough people have been infected or vaccinated, the virus will start to subside on its own because there will not be enough other people left to infect. And that's why we talk about this idea of all of us being in this together being so important. But there are complexities to this pandemic that make herd immunity a little bit more complex. So you all have been hearing about these things called variants, which could create waves of new infections and affect our vaccines. Also, we are still learning about what to make of those individuals who've been previously infected with coronavirus and how long they have immunity. So there are different things that we're still learning about and how that could affect herd immunity. However, this is again why it's so important for people when they have their shot to get vaccinated. The more people that we get vaccinated and the more people that we get immune, it's going to be so important to reach that level of 70 to 85%. So then there's no other people that can get infected by coronavirus. The next question I have here is, how was the vaccine developed so quickly? A lot of people have questions about this. A lot of people have concerns because they think the vaccine was developed too quickly and that maybe we cut corners. But as I mentioned before, this technology, this mRNA technology, is something that has been being studied for at least 30 years. And there are other vaccines for other infectious diseases that have been studied for this particular type of vaccine vector. That's the first point I want to make. But a couple of other points. Number one, because this vaccine was developed during a pandemic when we were able to recruit so many people in such a quick period of time, that was very important for us to move through the different phases of the clinical trials because we had so many people willing to participate in the science of the vaccine. And we were able to recruit people very quickly. Number two, we were able to move through the vaccine development process because the government was willing to just invest so much money. This was a huge scientific endeavor on a scale that has never been seen before. And that really helped move the science along. When you're willing to invest resources and money, you can just help get things done much quicker. Number three, we were able to combine various phases of the clinical trials to make them also move along quicker. So the phase 1 and 2 of the clinical trial, we were able to combine together, which also helped make things move along quicker. And then finally, typically we don't start manufacturing the vaccine until after the 3rd phase of the clinical trial, which then takes months to help happen. In this case, because of the dire situation of the pandemic, companies started manufacturing the vaccine at the start of the phase 3 of the clinical trial, basically saying, hey, we're going to put our eggs in this basket. We're going to manufacture the vaccine regardless of if the trial is favorable or not. We want to make sure the vaccine is ready once the clinical trial is over. So we're ready to go and distribute the vaccine once we have the data. And so if the data was not good, they would lose the money and the investment that they put into manufacturing the vaccine. So that, I think, is hopefully will help answer some of the questions people have about how the vaccine was developed so quickly. The next question I have here is, will I need to continue wearing a mask and social distancing after I'm vaccinated? And that's a really important question. And the answer to that is yes. So the things we know about this vaccine right now is that the vaccine helps prevent you from getting coronavirus and developing severe disease. What we still don't know yet about the vaccine is we don't know if the vaccine helps prevent you from transmitting disease to other people. So I know if I'm vaccinated, it protects me, but we're still learning about whether or not I would be able to transmit it on to my family, my friends, my coworkers. And so it's really important once you're vaccinated to continue to adhere to those really important public health measures we've been talking about for the last year. So wearing a face mask that fits good around your nose and your chin and lays flat against your face, using good hand hygiene, remaining physical distance, so at least 6 feet, avoiding crowds of people. All that is really very important. Then let's see here, a couple more questions. How long will the vaccine protection last? And will I have to get another shot next year? So that's information we're still learning. Remember, we maybe have about 4 to 5 months of data so far. So thus far, it looks like the protection of these viruses these vaccines still looks really good, but we're still learning that data. So I would stay tuned for that. And some of that also may depend on some of these vaccines companies also developing booster shots for some of the variants that we are learning about. So that might be something that comes down the pipeline. And that actually leads me into the last question, which is, will the vaccine still work for the new variants? And that's something that we're also still learning about. So there are a couple of different variants that I know people have been learning about and we've been talking about. So the B.1.1.7 variant, which has been called the UK variant because that's where it was first discovered. It looks like the Moderna and the Pfizer vaccines still work against those variants. The newer variants that people have been talking about recently, the B.1.351 variant, which is also called the South African variant. It looks like both the Moderna and Pfizer vaccines still work against that particular variant, but maybe have a little bit decreased activity. They're still doing some more research on that one. And then the P1 variant, which is the one that they've identified out of Brazil, they're still doing some work on that one. But they are looking at developing booster shots, which might be something that we have to get later on as we learn more information. And I think, that brings me back to something that I've been talking about a lot, is that it's really important that we try to decrease the rates of transmission and the amount of circulating virus that we are seeing in our community here in South Carolina, here in the United States, because if we don't get that amount down, we are going to see other variants pop up and put more pressure. We're putting more pressure on the virus to develop more mutations, and that will continue to affect our vaccines. So I really urge people, I know it's hard, we're having a really hard time, this has been going on for over a year now, to really do everything we can to try and double down on our public health measures and really adhere to these things we've been talking about for the last year of wearing face masks and trying to avoid crowds of people. It's going to take all of us to try and get out of this pandemic. And, we do know that these vaccines are good, and we're doing everything we can to try and help roll them out as quickly as possible. So hopefully, over the next few months, we'll get them out even quicker. Now we have the J&J vaccine that's going to be going up before the FDA, and we will have another tool in our vaccine toolbox to try and help get people vaccinated. So with that, I've answered all the questions that I had. I'm going to see if there are any other questions that have come my way. So one of the questions I have is, can you get a vaccine early if I have a doctor's note? And unfortunately, the answer to that question is no. We have very strict rules about having to stick to the state Department of Health guidelines. So right now we are still in phase 1A. We are vaccinating individuals over the age of 75, but as of Monday, we will be vaccinating individuals over the age of 65 in the state of South Carolina, and frontline healthcare workers and people who are living in nursing homes. But we can't make exceptions to that. Otherwise, we would be making exceptions here and there for everybody. So we're required to maintain the state's rules for who we vaccinate. So no exceptions for that. The next question is, I received my first dose but was unable to get my second dose within 23 days. Can I get the second dose late? Yes, you can get the second dose late. We urge people to get the second dose as soon as you can. And so make that appointment as soon as possible. One point that I would like to make is, if you cannot make the appointment for your second dose within that time frame, please go ahead and make that appointment for that second dose as soon as possible. The other point I would like to make also is, if you do miss that second dose, you do not have to restart the vaccine series. You just go ahead and get that second dose as soon as possible. I get asked that question quite frequently. So no need to restart that vaccine series if you miss the first dose. The third question is, when do you expect kids and teens to be approved for the vaccination? That is a wonderful question. So as people may be aware of, the Pfizer vaccine is approved for individuals over the age of 16. The Moderna vaccine is approved for individuals over the age of 18. Pfizer and Moderna are both conducting studies right now in individuals from 12 years old and above. So hopefully we will have that data available later this year. So we will be able to get teens and older, or teenagers and adolescents vaccinated later this year. So that is a really great question. We want to be able to get teenagers vaccinated and kids vaccinated. That's we worry about them also being infected with COVID. Number 4, can I get the vaccine on Monday if I'm age 65? Yes, as of Monday, we will be opening up vaccination for individuals 65 and older in the state of South Carolina. So yes, you can get vaccinated if you're over the age of 65 in South Carolina. I will note that MUSC is also one of the institutions in the state of South Carolina that is also already vaccinating our inpatients over the age of 65 at the time of discharge. So that is something that we are doing here as well. So lots of good stuff going on here in South Carolina to help get the vaccine out. With that, I think that's all the questions we have today. Thank you so much for joining us. Have a great day.